Data released last week by the CDC suggests America's drug epidemic is more deadly than ever. Over 100,000 people died of drug overdoses in a 12-month period ending this past April, a new record high, jumping almost 29% from the previous year. This isn't a problem that's central to big cities. Small towns are being hit just as hard.
Isolation, I think the stigma, I think some of the other things, that poverty, unemployment kind of issues, I think all play a role in an increase in substance use disorders and difficulties associated with those substance use disorders in rural areas.
UNMC Dr. Kenneth Zuha says alcohol and meth are popular substances used in rural communities, along with opioids, legally prescribed for pain but have a high risk for dependency with continuous use.
There's lots of issues surrounding pain in folks that live in rural areas, urban areas as well, don't get me wrong, but just a higher incidence of pain from hard work and overuse injuries.
I think one of the biggest things that comes with treatment is what types of treatments are available, and are those types of treatments what is going to best suit somebody.
Patrick Habecker with UNL's Rural Drug Addiction Research Center says people in these areas face barriers when it comes to getting help, like lack of access to certain treatment options or issues with transportation.
When you're outside of Lincoln and Omaha, Grand Island even, to what extent is it easy to drive 10 miles, 20 miles, have to spend an hour in a vehicle regularly to sort of get this treatment?
A map on the Substance Abuse and Mental Health Services Administration website shows just how sparse treatment centers are in smaller communities. In Omaha, there are 119 facilities listed in a 100-mile radius, compared to North Platte, where there are only 12.
When that moment arrives where someone's looking to reduce, change how they use the substance, or completely remove it, you want as few barriers as possible there. You want to make that an easy transition where the services are available, easy to access, and they're not going to face a whole bunch of stigma for walking in the door.
Reporting in Omaha, Danielle Meadows, 3 News Now.